the basic emphasis last time was to do the Benedict test properly, and that is what you are supposed to do. Now it was basically glucose in urine. That is the test. Now normally it doesn't appear in normal individual. In otherwise healthy individual, glucose is not detectable. Now when it is detectable, that part I forgot to tell you. I thought that urine formation will be there, or there will be extra class of total glucose tolerance test. At that time it will be covered, because once urine formation is discussed or you are taught in the class, you will understand better. But I thought it will be prudent right now to tell you when glucose will appear in urine in patients, because in normal person it doesn't occur, that glycosuria. So that abnormal constituents I will just have a hurriedly go through. So this part I have told you, this part also have been told. So don't forget that composition of Benedict reagent. You have noted it very clearly though, that dispense 5 ml of reagent and then add 8 drops. I am not allowing 0.5 ml in during the practical class, because in the examination dropper will be given. So you practice with the dropper. As I told you earlier also, that if you cannot suck 5 ml at a time, so you can draw 3 ml and then 2 ml or 2 ml, 2 ml, 1 ml. Basic requirement is that you have to dispense 5 ml of Benedict reagent in the test tube. That you do the way you like, because it will be difficult with the 5 ml pipette to suck it using that rubber bulb. I am telling you, if you press a little very hard here, the negative suction will be very high. So it will, the mark is here. So there is a chance that it will cross this thing. But if it is 10 ml pipette, the 5 mark is here. So that will be easier. Depending on whatever will be given, whether 5 ml or 10 ml pipette, your basic purpose is to dispense 5 ml of Benedict reagent into it. And once you do it, then you add 8 drops and mix it, because that is a very dense solution. It will not get mixed properly. So you have to shake it at almost 2 to 3 seconds interval to allow mixing, proper mixing. So again, I am repeating, prevent bumping and allow it to cool spontaneously. By the time while you will be heating, you will be seeing the change in color. And the spectrum of color will get, there will be 3 solutions. One will contain high concentration, one medium concentration, and one is low concentration. And in examination, usually this type of samples will be given. 3, 4, 5 different types of solution will be given. Even some solutions will be given where there will be no glucose. So no glucose detection is also a finding. Don't think that even sugar is there when Benedict test is there when it has to be positive. So negative result is also expected during examination. This part I have told, orange to red, remember, I am telling you once again, it is 1500 or more than 1500, because with 1500 milligram per deciliter, the entire reagent will be exhausted. The proper cupric sulfate will be exhausted. That even if it is more than that, 2000, 2500, 3000, there will be no more cupric sulfate available, copper sulfate available to react. And that is the reason the maximum color development will be there with that amount of reagent. The principle I told you, again you just remember all these red light points, red marked points, red letter point basically. See, note down this one. See, Benedict test will be positive for all monosaccharides and only 2 disaccharides. I told you earlier also. Again, one thing I forgot, a negative sucrose I told, but polysaccharides I did not tell. That you remember, polysaccharides do not give Benedict test positive. And see, we have told about glycosuria. It's basically indicating reducing sugar. But for all practical purposes, in medical science, glycosuria is equivalent to glucosuria. Glucosuria is a very specific term. But in your future books, like medicine books or pathology books, whatever you will read, you will see that glycosuria term is there. Because even after 3 decades of doing plasma glucose estimation, we still talk, all doctors, even patient talk, general public talk that blood sugar. Blood sugar is not the actual term. Either you have to say blood glucose or in the laboratory setup, actually we measure plasma glucose. We do not measure from the whole blood. We measure glucose from the plasma. So this is synonymously used. So glycosuria is synonymously used with glucosuria. So reducing substances, I have told you earlier also. I will demonstrate today non-glucose reducing sugars. Those who are interested, because this is not part of your syllabus, you have to do sugar in urine. Those who are interested, they can see this part, otherwise you can leave. So I have brought vitamin C, I have brought non-glucose reducing sugars, I have brought disaccharides, and unfortunately these materials are not available. That's why I could not bring it. So after you do the test, those who are interested, you just come and spend a little time. It will take about 45 minutes to 1 hour time to get these things done. So one thing you write down, renal threshold for glucose, when glucose will appear in the urine. So when blood is filtered at the glomerular filtrate is formed, and that contains, as I told you earlier, that it contains almost everything of plasma except large molecular weight, that is colloids, proteins, non-polar substances, lipids, bilirubin. They are not present in that glomerular filtrate. Now glucose B is a very energetic substance. Similarly, amino acids. We do not want glucose or amino acids to be lost in the urine. So there is a mechanism to reabsorb the filtered glucose amino acids from the glomerular filtrate. Now each nephron has a capacity. See, I have a capacity to lift 20 kg weight. So if more than 20 kg is given to me, the weight will remain there on the floor itself. I will not be able to take it up and pull it up. Similarly, the capacity of the nephron is to absorb when the blood glucose level is or plasma glucose level is more than 180 to 200 milligram per deciliter. See, in your book you might find venous glucose 180 figure, you might get 200 figure in some books. Basically, you will be doctors and you will be reading medicine books. And the Harrison's medicine is a reference book for medicine. And since we measure plasma glucose, this threshold has been described with respect to plasma glucose is more than 180 to 200 milligram per deciliter. And if anybody says about this thing, you tell that it was told in the class that this plasma glucose 800 to 200 has been taken from the recent edition of Harrison's medicine book. So nobody will then challenge, nobody will say anything. Whatever written in biochemistry book, that is basically not of much concern to you because you will be doctors in future. That might be a general book also. So remember, if the plasma glucose is more than 180 to 200, somebody's blood sugar glucose level is 250. So nephron will not be able to absorb. So that extra amount of glucose which is filtered will appear in the urine. And that is the reason why glycosuria occurs in diabetic patients, not in normal individuals. So each substance is having a capacity, threshold. Like we are all having some amount of threshold for anger, for hunger, for satisfaction. We are all having threshold. If it crosses, then it becomes difficult. Similarly, for glucose, this is the figure. For amino acid, there is another figure. So if the plasma glucose is more than 180 to 200 milligram, then glucose absorption capacity by the nephron basically essentially or the kidney is exceeded. And that is why glucose appears in the urine. And this part, that figure is called renal threshold. So glycosuria in any individual indicates diabetes mellitus until proved otherwise. Until proved otherwise means in normal individual, if she is a female, there is a chance that during lactation or during third trimester of pregnancy, there is a chance of lactosuria. So the lactose might appear. In other cases, particularly in the child, all those things, pentosuria, fructosuria, all these things I have discussed, galactosuria, these will appear in the child pediatric age group. It doesn't occur normally in the adult. So glycosuria in any individual, Benedict test positive in any individual, take it for granted the patient is having diabetes. Now, we try to understand the more the glucose in the blood. See, here we said if the normal blood glucose is called normoglycemia. Earlier I told you level of glucose in the blood called glycemia. So if the normal level is there, so this is called normoglycemia. If there is more blood sugar, that is called hyperglycemia. If there is a low blood glucose, that is called hypoglycemia. So the more the glucose in the blood, that means the more the hyperglycemia. Somebody is having 250, somebody might be having 400, somebody might be having 600. So the more the glucose in the blood, more will be excreted in the glomerular filtrate, so more will appear in the urine. So the more the hyperglycemia, the more the glycosuria. So that is basically proportional. Now when the disease is diagnosed at a very early stage, so disease in the mild form. So in that case, sugar level will might be 200, 250 maximum. So in that minimum amount of glucose might be excreted. And in the urine you will get a glucose stress. Stress means slightly negligible or 1 plus. Or suppose I had a severe diabetes. Suppose 500, 600 blood sugar I had already patient had. Now you have started treatment. Now after treatment, at the time of detection it was 4 plus. Now since the patient has controlled his diet or taken medicine, ideally the blood glucose level should come down. So his urine sugar, which was earlier 4 plus, will become 1 plus, or it might be negative also if it is well controlled. If it is below 180 to 200, so indirectly from urine sugar you will get an idea whether the diabetes has been controlled or not. So I have categorically written that mild type of diabetes, or early stage of diabetes, or controlled diabetes. Then you will get urine sugar either as trace or positive. It may be nil also. But early stage, at the time of detection, there is a chance that you will get it because it has crossed that limit. Similarly, if there is disease severe, very high at the time of detection, most of the cases are detected when the disease is very severe or the patient presents with complication, because this doesn't give symptoms. That is the biggest problem of diabetes. And same thing is true for hypertension, same thing is true for cancer. When the cancer is diagnosed, it is detected at the last stage, at the stage 4. Similarly, when diabetes is detected with the symptoms or with the complications, the blood glucose level is usually in the range of 400, 500, 600, 700, we don't know. It's not normal. But if you go on casually detecting and evaluating yourself, then at the very early stage you will be able to diagnose the disease. I would say that all of you, since from affluent society, you are taking much more food than desired, and you do less exercise, and there might be family history also. So it is better to get a blood glucose or plasma glucose done every year, including urine sugar, so that if the disease is there, you can immediately have a break or start a control system. Because if you ignore it, then you have to pay a heavy price at a later stage. That I do not want. Not only for you, but for anybody. So I will show you, as I told you, vitamin C is a very strong reducing agent, and you will say yourself that it doesn't require heating. And you will see from vitamin C how slowly it comes to the bottom. If you give 5 drops of vitamin C solution, the solution being dense, it will come gradually down, and it will see the spectrum of color where it is just the moment I will add it, vitamin C. Banana I have brought, I have dissolved it in water. Molasses I have brought, I will dissolve in water in front of you. Rice again I have brought from the canteen. Potato I have brought, boiled potato from the canteen to them. Lactose, as I told you, it was brought from microbiology department on the very first day, and that was sealed, that was kept in a paper packet. Similarly, sucrose in pure form from the microbiology laboratory. And the sucrose, ordinary what we take normally, that sugar. As I told you earlier, that sucrose is pure in form, its cost is very high. There is no admixture. But ordinary sucrose, ideally you should not get a positive Benedict test. but because of the contamination, you might get a positive result. Occasionally, this I have experimented many times, and many times I found that there is no negative, there is no positive result. They all are negative. But 2 times I found it to be positive, and then I realized that there is some admixture. Because see, life is an experiment. You have to do experiment continuously. Otherwise, nobody. If I ask you anybody, they might be able, no, it will not give. Now, nobody has tested at least 20 times, which I have done. So whenever I used to go to the market, you bring and take something to the laboratory and they test it. Is it giving positive result? Because I had an idea that there might be some amount of impurity. But this is costing somewhere around 20 times higher than this one. So that was proved, and you can see also today a slight change is there. That means it happened during processing. Sucrose is prepared from glucose and fructose, either glucose may be present, fructose may be present. So this solution will be prepared in front of you, and you can see it. First you concentrate on doing the urine test. And those who are interested to see this thing, just stay back. So do it fast and come to me. Otherwise, it will be very difficult to manage within 1 o'clock there. This is banana. This is molasses, good. This is rice. This is potato. These are all polysaccharides. So this is lactose in pure form. This is sucrose. This is lactose sucrose. This is also sucrose. Sucrose, no? Sugar. Yes, sugar means ordinary sugar. So this one is sucrose. This is glucose. Yes, glucose. Dipstick will be there. See, just as I told you earlier, right now I am demonstrating this one. This cumbersome procedure is not done. There is simple procedure to do this thing. I told you one strip can be glucose only. Normally glucose is not available in the market because glucose protein is one type of multi-strip is available. Or the 2 parameter. And another is all the parameters which you will be doing. So multi-colored, multi-parameter glucose strip is there. I told you on that date you can dip it here, or you just go and ask the patient to pass urine directly on it, so that there is no requirement to use this test tube again. This is a problem of washing, throwing these that. So what is done in practice is the patient is asked to hold like this. You just just hold on left hand. Go to the toilet, pass urine on it and bring. So you are not touching anything. Now by the time you return from laboratory, almost 1 minute time will be there. So the time is calibrated here depending on the kit, whether it is 30 seconds or there is 1 minute. If it is 30 seconds, usually it is not allowed because you might come late. So that time it will be for 1 minute. I will tell you, that person will tell you, just come as quickly as possible. So that time is important because this is an enzyme impregnated strip. If you allow more time, here also you will see the color will change from which is originally green. If you allow this thing to time to pass, it will come to 4+. So the color matcher is there, so you can match the color. Now I have prepared yesterday the glucose solution. There is a glucose solution. I have taken a small amount of glucose, and this I have prepared today. All of you can have just first and foremost have a look at it. You see that glucose is there, this glucose is there, 4+, 3+, whatever I have said in the literature, the same thing is written here. Now here the glucose mark is this one. So we have to observe change of color of this bluish, whether it is change in color or not there. If there is no change in color after 30 seconds, that means there is no glucose. If color changes, then the glucose is there. So right now I am dipping it. Can you see the color change? So exactly at 30 seconds you have to note it down. Hold it, hold it. See the last one. The color by this time has changed. Now you match it. Where the color matcher is there, match it. So these I have given a little high concentration to show you the spectrum of changes. You got it? Similarly, as I told you that for polysaccharides you will not get a positive result. Sucrose in pure form will not get a positive result. Lactose you will get a positive result. You just, somebody should open it. Open. Kholo. This is sucrose. That means it is pure form of sucrose. Chini. Pure form of sucrose brought from the laboratory. It's a pure glucose. Pure sucrose. This is lactose. You see the difference? It is dust like powder. Okay? Now, হাতে দিয়ে দেখো. Open it. Open it. Mixing করে দিও না. Ordinary sugar. This is ordinary sugar which I have brought from my room. This is taken normally with the tea. I told you there might be an admixture. You might get a positive result, you might not get. But here you will not get. See, normally polysaccharide is in the form of starch is not so soluble in cold water. And that's why I have put in hot water. This is rice. And this is potato. Today from the curry I have taken a little bit of potato. And here what happens, it might give some amount of positive result because if it is severe boiling, some amount of maltose might be formed. So there is a chance that it will get it. Even with rice it is possible. But rice I have taken, you can see this rice. This rice there is a little chance. So somebody has to mix this part. Those who will be participating, they let them do this thing. I want that they should do this job. So polysaccharides, 2 polysaccharides I have brought, 2 disaccharides I have brought, monosaccharides I have also shown already, and monosaccharides we will be doing, and vitamin C I have brought, fruit I have brought. Anybody has brought any other fruit, sweet fruit? No, this is the picture and this is the third class. Nobody has brought, so I could not show it to you. And many sweet fruit. People are under the impression that we are taking sweet fruit, nothing will happen. You see the banana, what is the state of affairs? This I'll put a little bit more water. I have taken only a small part because this was wasted for 2 days. I have taken only a small part of this one and dissolved it and put the volume here and you see what is the concentration. And I checked it during in the laboratory. This is a small part, this much I have taken and dissolved it, and the concentration was 10,000 milligram per deciliter. So banana is a high risk food. So do not take banana too much. The blood glucose level will shoot simply. Similarly, if you would have brought dates, you could have seen what is the concentration in dates.